It's that time of year again as temperatures drop and the seasons prepare to change. Many start to feel sick. And then, of course, the question, is it COVID? Is it allergies?
Yeah, a lot of people are asking that question. The virus is circulating, but pollen counts are up as well. Health and wellness reporter Lauren Petty is here to sort of break it all down for us. Lauren?
I know it comes up this time of year. We have to talk about it. It is this week or two, the end of August, the beginning of September, when people with fall allergies really start to feel it. The latest pollen count found ragweed and weeds at moderate levels, and the mold count is at high levels right now. So that can lead to sneezing, those itchy, watery eyes, even some congestion. Now, the allergens are hitting right as we continue to see high COVID activity in Chicago. The Chicago Department of Public Health reported a slight dip in test positivity this week, but with overlapping symptoms, it can still be hard to tell what you're suffering from.
If you're feeling itchy symptoms, so like the itchy eyes or itchy nose, sneezing, things like that, most likely it's your allergies. If it's more congestion, headaches, or a lot of like post-nasal drip or other things, it still can be questionable. Is it allergies or is it COVID? I would say get a home test, just check it out and make sure it's one or the other.
Yeah, you have to check it out and take a look at this chart here. You can see sneezing is technically the only overlapping symptom here. To prevent serious illness from COVID, there are updated vaccines from Pfizer and Moderna. They are now available at most major pharmacies, and flu shots, they're in too. But here's a word of caution if you're considering getting both shots right now. One infectious disease doctor that we spoke with recommended waiting a few weeks to get your flu shot. Only one is recommended every year, and flu season can last all the way through spring, so you might want to wait a bit for that. Now, another story we've been following for you is the Mpox outbreak in Africa. Today, the World Health Organization and the Africa Center for Disease Control and Prevention launched a continent-wide response plan. There have been more than 5,500 cases in all of Africa so far this year, with 643 deaths. Now, there is a 2-dose vaccine for Mpox. It is available here in Chicago as the city's health department continues to monitor cases. I can tell you, we checked the dashboard. There have been 7 additional cases reported in Chicago since the WHO declared Mpox a global health emergency 3 weeks ago, but no spike in cases at this time. And finally, we do have an update on a story a lot of women and girls are talking about. Earlier this summer, you may remember, researchers reported finding 16 heavy metals in tampons made by 14 common brands. Well, now lawmakers, they are getting involved. The Democratic Women's Caucus, which is made up of all the Democratic women in the U.S. House of Representatives, they wrote a letter to the FDA urging the agency to review and improve the current safety standards for tampons. Now, the authors of that research, the study, they say more research is needed to determine if the metals in tampons pose serious health risks, and that's something these women in Congress and so many of us want to know as well. Marion.
Quite a rundown today. A lot going on. Thanks so much, Lauren. Appreciate it.